Welcome to NJ Press Pass's premiere, COVID and Classrooms. I'm your host, Carly Romalino, watchdog reporter based at the Courier-Post in Cherry Hill. And today, for the first episode of this live series, you get to wear my press pass, tap into my contact list, and ask all the questions. This series aims to give you access I have as a reporter to experts and decision makers in our state. I'm following your lead this time and letting you tell me who you want to hear from on each episode. As we move swiftly toward the start of the school year, you're already asking about COVID-19's impact on learning. So I've curated a panel of experts in science and education to field those questions. With us today is Dr. Judith Lightfoot, Chief of Infectious Disease at Rowan University's School of Osteopathic Medicine. She developed the university's plan to reopen the medical campus for faculty, students, and patients using medical services there. We're also joined by Sean Spiller, Vice President of the New Jersey Education Association. His organization is leading opposition in in-person instruction this fall, and he's also the mayor of Montclair in Essex County. Katrina McCombs is also with us. She is Camden School District Superintendent, and after planning a hybrid model, she just announced her district would begin the year with all remote learning. Tina Dare is also with us. She's a 2-decade chemistry teacher at Delsea Regional High School in Franklin Township, and she leads the Delsea Education Association in Gloucester County. And finally, Rue Ryan, Lumberton Township committee woman and a mom of 3, who is on the ground deciding whether in-person or all virtual instruction is right for her young children. So we have a dozen or more questions that have been submitted to us already, but through our conversation, I invite you to take full advantage of your access to Dr. Lightfoot and the panelists' expertise and ask your questions in the comments. Make sure to share this episode in your news feed so friends have an opportunity to get their questions asked too. So, we'll get to as many questions as we can, and if we run out of time, you'll get your answers one way or another. Answers will be posted to our Facebook group, NJ Press Pass Web Series group, and on the websites for the Courier-Post, Daily Journal, and Burlington County Times. So our first question, panelist, is from a Rancocas Valley Regional High School junior, and she gets right to the heart of this debate. Let's take a look at what she has to say.
Hello, my name is Isabel Rodriguez, and I'm a junior at Rancocas Valley Regional High School. The question I have for you guys today is, do you think schools going online only for the first semester and then reopening for in-person classes the second semester would be a better idea than just partially opening schools now? Thank you.
So I'm posing this question to Sean and Katrina first, but Tina and Rue, feel free to jump in if you want to add something on this.
Sure.
Well, go ahead.
No problem. Sorry about that. I'm sure I'll jump in from my perspective. Being a district superintendent, you have to make sure that you are definitely thinking about the needs and concerns of all of the various families and stakeholders who we serve. And so to your question, Isabella, it was a great question and you articulated it in a wonderful way. And it's really on point. So for the Camden City School District, we have decided to begin the year 100% remote. And that is what works best for the Camden City School District, given the number of buildings that we operate and also the staffing limitations that we were experiencing due to teacher requests for accommodations and other staff member requests, as well as about 50% of our parents opting out of in-person instruction. So for us, we had to make the decision that was best for Camden City once the governor allowed for the opportunity on that flexibility. I have many colleagues in many different school districts of different sizes, and they may have less issues and less challenges when it comes to ensuring that every student and you and your classmates will receive a thorough and efficient education. So I would say to you that the decision that's made for in-person versus hybrid is definitely unique to each school district. And for Camden City, we believed that beginning the year fully remote and then transitioning back to follow the science, as well as to make sure that our building and filtration systems are in place, as well as our staffing levels are consistent to support health and safety. Those were the reasons we made the decision. And thank you very much for your thoughtful question.
So Sean, did you want to jump in there?
Well, I also agree. It was a great question. I think it gets right to the heart of what we're all talking about here. And I might only just split it into two pieces. First, I want to commend so many district teams that have been working on reopening plans to try and bring everybody back as safely as possible. We know that it's not an accident that New Jersey has the very best schools in the nation, so it shouldn't be a surprise that we're working on doing the very best, either virtual distance learning, remote learning, or some type of hybrid models that people have been working at. But I would just say, when I split the question slightly, when we talk about, do we think it's safer to return for the second semester, I just want to emphasize that the virus is driving a lot of this. The science is driving a lot of this. Every time we look back where we were 2 weeks ago, 3 weeks ago, 6 weeks ago, it is night and day often from where we currently find ourselves. And I think we have to be mindful that when we set arbitrary dates, we sometimes lock ourselves into something that doesn't then match that science, doesn't match the safety. First and foremost, we all have to be concerned, number one, as the governor says, period, full stop, with student safety and staff safety. Beyond that, we are working through plans. We see what can work. But if we don't meet that initial threshold, then we just can't bring people in. It's that simple. And I think when we've looked and seen that the association that represents superintendents, the association that represents principals and supervisors, have said that we're not ready yet. We're not ready to open in person in September. Give us more time. Let us keep working on the different plans. Let us keep seeing where the science takes us. I think we should listen to that advice, and I think we should make sure we can do this safely.
So throughout our conversation, I'm going to be jumping in with answers that I've already received from the Department of Education. I didn't want to leave that department out of our conversation, although they couldn't provide a panelist at this time because they're working on this. So questions that were given to me ahead of time, and they're your questions that came in early, they did provide some answers and some context. One of the things that I want to add from my conversation with a Department of Ed spokesman is they said already, and this is anecdotal information, but as last count yesterday, 139 public school districts in the state out of the 600 school districts and 90 charter and Renaissance schools. So 139 have already applied to start all remote. So does anybody want to weigh in on that figure? I'm sure it'll change. It'll either go up if more districts are running into issues, but maybe not all of them will be approved for this plan. Anybody want to comment on that figure? Is it high, low, where it's supposed to be? Does anybody even know at this point?
Yeah, Carly, I'll weigh in from my perspective on that. So as I shared when I was responding to Isabella's question, each district is still assessing, and Sean spoke to this as well, is still assessing what's best for them and what works for their unique environment, and also what works given the rates of COVID positivity in their communities. And so I believe that the difference are the numbers that you cited, and something that could be driving that information just has to do with that difference and diversity and what school districts need. Also, I do believe that as more information comes in and as staff members put in more accommodation requests, et cetera, that number may still fluctuate and change. But again, I believe that each district is just trying to do what they've been charged to do, which is to make sure that we maintain a high standard of health and safety first and foremost, and then move forward. So it'll be interesting to track that data over time to see if it remains the way you shared it.
So as we know, staying at home in isolation doesn't solve everything. And actually, Isabella's twin brother, Lucius, submitted a question along with her, and it has to do with hands-on classes, especially for students in tech schools. So he's a Burlington County Institute of Technology junior, and he has a question for the panel on that point.
Hello. I am Lucius Rodriguez. I'm studying computer science at the Burlington County Institute of Technology. One thing that I've been wondering is how would trade schools and hands-on classes be treated throughout this year?
So, Tina, you're a science teacher, and I know that you have to do a lot of, very visual lessons and getting students to work together. What are you hearing? What is happening in Delsey Regional? While it's not a tech school, there are hands-on classes.
So I would start by saying that I really appreciate his question, and that this is an issue, I don't think just for our trade schools, like you mentioned. This is an issue that goes far beyond just those schools and those types of classes. I mean, if we even look down to like kindergarten, how much time we spend with kids interacting with one another and how difficult that's going to be this year. So it is not just a trade school issue. I think it's an issue across the board when it comes to public education, because we really believe in students collaborating and working together. So I would say that there's no great solution for any of this, but what we have to do is we have to come together as educators, and we have to find ways to engage students online. That we have to make sure that we're finding ways and doing things differently than we've ever done in the past. And it's going to take a lot of creative things by our teachers, and that's what a lot of our educators have been working on all summer, is finding ways to engage students online, because like Sean has said, safety is our number one priority, so we don't want to put that ahead of anything else.
Rue, as a mom, and you have two of your children are in elementary school. I think one is in either kindergarten or preschool. But for your two older children, are you worried about them not having hands-on work and really group projects and missing those skills for the first semester?
So it's really funny that this question is being brought up, because my son and I actually were just talking the other day, and he is going into 8th grade this year, and he's very much into technology and computers. And one of the things he said to me is, Mom, I really hope that my technology classes aren't until the spring, and hopefully I can get back into the classroom. So it's a hard decision as a parent, whether to send your child in or to keep them home. In our home, with the discussions with our children, we just decided as a family whole to keep them home and do remote. They miss their friends terribly. They miss their teachers. And I know that the teachers in the school miss their students, and they miss that hands-on. It's definitely been a challenge. One of the things that we coped with last year when we switched to remote is we helped our kids at home, trying to do a lot of the hands-on projects, the PE, the art. And then for my son's birthday, we bought him computer parts, and he taught himself how to build a computer. So it's kind of switching gears and just trying to do more at home with them, since they can't really have that interaction in school right now.
So we are going to switch gears and bring Dr. Lightfoot into the spotlight for a couple of questions. But I do want to remind you, you can still participate in our conversation by putting your questions in the comments sections of our feeds, and we will get to them. We will run them by our panelists, as many as we can. And if we can't get to them, I will get you answers sometime next week. But Dr. Lightfoot, questions are coming in because they're trusting you as our COVID guru. So Jamila Damiani from Woodbury asks about symptoms of COVID in kids. She asks, as a parent of 4 children, 2 of which are toddlers, one attending pre-K4 this year and one attending kindergarten, how are parents in schools supposed to navigate the typical back to school cootie season, as she says, and COVID symptoms? So she wants to know how to tell the difference.
Okay. So it's very difficult. So I would say for Jamila is that often there are many symptoms of COVID, and you probably want to know how to distinguish them from basic like symptoms. But we pretty much know that it's not sneezing, but you can see cough, you can see low-grade fevers or no fever at all. But if your child is listless or sleeping a lot more than usual, we talk about shortness of breath, or dyspnea. Or we talk about the rash pretty much in the pediatric and the newborn period. If they have a rash, they can't be explained. Or they're not eating like they should, or they appear to be dehydrated. Maybe they're not urinating as often as they were before. Then that child should probably have a visit or call to their primary care provider or pediatrician. And Carly, let me say, you have to forgive me because I can't see my camera or monitor. So if there are questions coming up, you're going to have to read them to me. I can't see them all. Okay. So those symptoms, and for the schools, once they get there to pre-K, again, those children who are not responding as their teachers or the pre-K teachers or assistants know them to be responding. If there's a change in their behavior, they're not participating as much as they would from day to day on a daily basis. So they're complaining of a headache, and they may not complain, but they're not eating, they're not drinking. Those are early signs and symptoms we do see with SARS-CoV-19. They weren't recognized early on. And we do see nausea, we see diarrhea, and you may say, well, how do you determine that from flu-like symptoms? Well, early on, it's kind of hard to distinguish between the two. So the point of the matter is if the kids are under the weather, so to speak, or not feeling well, the children should not go to school. They should be kept home and observed. And what do I mean by home and observed? Again, are they eating? Are they drinking? Take their temperature. They can't hold a thermometer, put it under their arm or put it in their leg or in the growing area. Talk to their healthcare provider. Keep track of how well they're urinating, how many times they go to the bathroom, and their overall response. But do, as you all have may be aware of, as the pediatricians have noted, is a rash that sometimes occurs that comes and goes. Early on, we call it skin change with COVID-19, particularly if they're warmer and maybe a low grade temperature of 100. They're just listless. So we have to pay attention early on.
So in that vein, a school nurse had submitted a question. She's a school nurse in Harrison Township, Andrea Patterson, and she wants to know why we are not implementing a testing component in schools if we're expected to open. So I had some follow-up with her, and it seems like she's most worried about calling parents to pick up kids for maybe benign sniffles as a COVID precaution. She just thinks she's going to be calling constantly, but it seems like, these kids maybe shouldn't be in school anyway.
Well, that's a great question. Okay. For everyone, basic knowledge. With COVID-19, I thought about this as we rolled out with the task force here at the university. I would have to test everyone every day. And the reality is, I test you today and you're negative. That doesn't mean you're not incubating with the virus. So the incubation period, as best as we know it, it varies from person to person. So because you're negative today, it doesn't mean that you do not have the virus, or the onset of the virus is not in your system. So I thought about, what if if I test on a Monday and then repeat the test on a Thursday, at least I would catch the people who were negative on Monday. They should be positive by Thursday. And then if I test on Thursday and they're negative, I should catch them by Monday, the following week. Not necessarily it's going to work. What would happen if we had a rapid testing that was that was least expensive and could really give me on the spot an answer? That hasn't been developed yet. But it would allow me to detect those who are what we call not having any symptoms, but have the virus. That test and that level of sensitivity just has not been developed as of yet. But for those who had sniffles, runny nose, cough, just what we call rhinorrhea, regular coronavirus, that's not COVID-19, just the runny nose, I've got a cough, I have a sore throat. I just don't see that clinically with coronavirus 19. So I will be able to distinguish. But the point of the matter is for the nurse and for the parents at home, as adults here in the workplace, if you are sick, and we've asked our managers to be sympathetic and understand, and our administrators, if an employee is sick, understand, let them stay home, because we don't want to get everyone else sick. So I'm sure in the school, we'll have to make those determinations, whether they have to dismiss a whole class or worry about exposure of one child or one teacher. I'm sure those superintendents, those classroom teachers, and that school nurse would rather that child is ill, or that parent or whoever's responsible, to just keep that child at home and observe that child at home, as opposed to bringing them to school.
So I did get a kind of a brief answer from the State Department of Education. They noted on the rapid tests that you mentioned that the state received $310 million of CARES Act funding that was distributed to public schools. They said that tests could be one of the items allowed to be purchased with that money if they exist. And any coordination like that would have to go through the local, so the county health departments for that. But it seems like, Dr. Lightfoot, you said those tests don't exist yet. Staying with you, since we are mentioning your expertise, Dr. Lightfoot, in building a reopening plan, can you tell us a little bit about what strategies you took and what the Rowan University School of Osteopathic Medicine plan looks like? I know that we're going to have some questions coming up as far as HVAC systems, but can you tell us a little bit about that?
Well, first of all, it was a task force that we, not just an infectious disease expert, but we had people from different disciplines. From our heating and air conditioning, we had that expert on the panel as well. People from physical medicine and rehab, just about every discipline, operations, coordinations. We had employees. But basically, the first thing, what we had convinced the Rowan community that our job, first and foremost, was to keep everyone safe and healthy. Because it wasn't just the physicians or the healthcare providers. We have people who are not in medicine who didn't want to come anywhere near a medical center, who work in medical centers. How are we going to convince them? So the first thing was safety. With safety, that meant, how are we going to lay it out? It had to be signage. What did that signage mean? Rowan is going to be a safe and quality university center that is looking out for its Rowan family. So the 6 feet of social distancing, all of that signage. You come on our campus anywhere right now, particularly at the School of Osteopathic Medicine, you come up our walkways, there's signs greeting you 6 feet apart. There's signs on the ground telling you where to stand. There's someone greeting you at the doorways to take your temperature, although that's plus or minus, because depending on the temperature outside, I guarantee you have a temperature. So it's plus or minus, and I'll explain that in a little bit. But before you come in, the signs are telling you you have to have on a mask. You're going to come in. You have to have a sanitizer on your hand. We provide that for you. That has to be witnessed. ABCs, rubbing the sanitizer. We ask you screening questions. Have you traveled? Have you been out of state? Have you been with anyone with COVID-19? How do you feel? They're asking you that every day, that you, whether you're an employee, a physician, whether you work in environmental services, you come through those doors, or patient, you're being asked the same questions every day. And you're only allowed to be 6 feet apart. When you get in our elevator, it's one person at a time, because they're only but so big, but you're welcome to use the stairwells. To get up in the workspace, we redesigned our workspace. So as you probably have done so for the school districts and administrators who've had to put plans together, just from the sizes have changed, but so have our workspaces. We rotate. You've done a hybrid model. We've done sort of a hybrid model for the workspace. So some of our employees work from home, we rotate, and some work in the office. So those who have private offices, fortunate like mine, it's just me in this space. But so we have half the workforce at home 2 or 3 days, working from home, and then the other half come in. So as a specialist, we have specialty days for clinical practice. For our patients, they wait in the cars, they ring up to the floors, we tell them when to come in. I think you all are getting the picture. In the waiting rooms, we don't have overflow of waiting room areas anymore. Those areas have been marked with 6 feet of space for social distancing. And as an ID doc, I don't want more than 3 people in my waiting at one time. And the message is we get everyone back in a private room. So it is very clear. I don't want anyone in the hallways. We have no one in our hallways. Every patient is in the room. When I'm done with the patient, they're escorted out. The next patient comes in. It keeps me on time. They don't have to wait as long. And we're not double booking patients, if you will. So if you've been in a doctor's office and you've had to wait for hours and hours and hours, no more. So they check you in from your car. They get all your information the night before. So we try to streamline it. And we also have rooms. If you're really sick or I clinically suspect or your healthcare provider suspect symptoms with COVID-19, we have special rooms in which we take care of you in. All of our doctors, I guess you all can see me, wear masks, double masks of the N95 with a post-surgical mask on top. You don't see all my gear, but I have shields and I have goggles and I have another white coat over top of whatever I'm wearing, and we wear gloves. So we've laid all that out. But what about the people who don't come in contact with the patient? What is it like for them? We have signage at the bathrooms, the public restrooms. We have, if you've been exposed to COVID and had COVID and you've been cleared to come back to work, we have private facilities for you. Because I'm not into all of COVID, the disease state, and how long you can shed COVID. That's a whole nother medical discussion at another time. But there's a shedding period that goes on. But we have private facilities for everyone. But the bottom line is, when people see that you have done everything that you can to protect them where they can stand, the plastic partitions for the check-in staff. So there's big plastic partitions, you give them the insurance cards, they bring you back. So even the people behind the screens have them, and there's plastic between you and everyone. And then they take you back into the room. So everyone is protected. Even when you're in an administrative office, it's laid out that way. So we make sure we've done everything to make sure that you're 6 feet away from another person. An examination room is just you and your healthcare provider. If you're in an administrative office and then you were used to seeing 2 people together, it's 1 person there. Yes, we can assure that those 2 people can be 6 feet apart. For lunches, no one can eat, and we've closed our cafeteria. We made it like box and go. We still have gourmet food, but they boxed it. So you can grab a brown box and go. And we've taken our grounds, providing it's not raining outside, and put large circles of different colors in the 6 feet round circles where students can eat. And we have big atriums where people can sit 6 feet apart unless you have a private space where you can eat. Or for right now, we told them to eat in their cars. We know it's not fancy, but we're trying to keep everyone safe. But we have to figure out what we're going to do when it's wintertime.
So I do want to move into the next question. I'm sorry to cut you off there, but you might be jumping into already the next question that comes from a Clayton preschool teacher. And it's on this point of HVAC systems. And Dr. Lightfoot, you and I had a long conversation about how that was worked out at your office. But how about we play her question?
Sure.
Hi, my name is Sue Taney, and I'm a preschool teacher for the Clayton Public School District in Clayton, New Jersey. I've read that the virus is spread mainly through droplets through the air. And considering that a lot of schools have out-of-date HVAC systems that recirculates the air between multiple rooms, and many schools have no circulation or ventilation in their bathrooms, and the toilet seats have no lids. My question is it possible for the virus to spread from classroom to classroom via the HVAC system or between people by flushing a toilet without a lid? Considering this, I was wondering why there weren't any regulations regarding this from the New Jersey Department of Education's Road Back to Recovery. Thank you very much.
So Dr. Lightfoot, I'd like you to talk about that if you can, because that was something that Rowan's Med School took into consideration when building that plan.
Yes, we did. And again, we had our HVAC expert as a part of our task force. So it's summertime. So it was decided to run our systems. It's freezing in my office right now. It's probably 58 degrees in here. And I'm not supposed to have a heater in my office, but it's freezing. Now, with that being said, we don't have windows in which we can open to circulate fresh air. So they run at a lower temperature at all times, but then at a certain time of the day at night, after hours, because we run hours at night here, up until 9 o'clock for patients, then there's a fan system that kicks on. And then the system kicks back in to, again, bring the temperature down to a certain level. And that is so for increased circulation. Now, I don't know what the school system has, and I think it would be helpful to have whoever does everything for the school system to speak on that point. But I will say this. Enclosed systems, systems who don't have adequate ventilation, I can speak from that point, should have open windows for constant so the air can circulate. Also, whether you have a closed system, such as air conditioning, that you bring down to a certain, and good filtration system with an HVAC system, the filters have been changed, your experts can help guide this. And I don't think I need to tell the school district that. I think they have the experts can do this, because I've learned more about filters than I ever knew before. I thought I just knew it from the hospital system when we try to prevent transmission of tuberculosis and most importantly of COVID-19 in our units. But in terms of what actually goes on, I've learned a lot. However, I will say, in wiping down surfaces in terms of the virus, 48 hours on wood surface, steel surfaces, if we don't know that, we should know that. So we wipe surfaces every day. Every day we wipe surfaces. And in patient use, we wipe surfaces. Everyone is responsible for their work area every day. I don't know if you can see what I have here, but because I can't see you all, but you can see this, right? I'm not advertising, but this is here. So
that's gold in this area.
Okay, so. But we have one that is a different brand that we have for all of the staff, but they have to use gloves. This is my person that I have stock in. But we have some that the staff have with gloves that they wipe their personal space down, and in addition to environmental services. Now, in the rooms, our nurses wipe down between patients, but in common areas, we wipe everything down. I think that goes without saying. Everybody, we do our own doorknobs, they do our doorknobs, but we also do our own doorknobs because we just want to make sure we're not leaving any lines around. So when you talk about schools, you talk about pre-K, you talk about first graders, I'm sure you all have built in a plan as to how you're going to do this. Some may have some partitions. Some may decide to wipe down the desk between each class of students if you're changing classes. Either way, surfaces have to be wiped. I don't think I need to say that. I think you know that. But in terms of the bathrooms and a system that is closed without ventilation, some may frown at this, but you may have to keep the doors off or take the doors off the bathroom for circulation. Or is there a window in the bathroom? If there is, the window may have to stay open. As far as lids, I would assume she's talking about pre-K or an elementary school. I don't know. It's been a long time since I've been. My son teaches in campus, but I've never asked Aaron what's in his school. At Woodrow Wilson, I don't know what they have. So, I don't know if they have lids. I don't know. So it's been a long time since I've been in anyway. Well, if you have lids, If any bathroom has, I will say this as gentle as I can, and you had a patient with suspected COVID, then the back of the lid should be wiped down. That's as delicate as I can put it. Now, chances are where our numbers are good right now in New Jersey, and I would like to keep them where they are right now and see them continue to go where they need to go, providing we all do the proper things. Wear our masks in our hands, and good old soap water always works well, and gloves if we have to wear them, and wear our masks, and I think do all those things, we're going to be fine. But I understand where she's going with that, but I think when every system does what they need to do, we're going to be fine.
Great. So I'm going to ask a question that just came to us from Amanda Harvin. She asked this in the comments. This is for the educators. Will the teachers provide on-screen instruction at the start of the new year? The end of last year felt like loads of homework with me as the parent teaching. I understand it was unexpected. However, now these districts have had an entire summer to figure this out. Will there be regulations for this regard from the NJEA? So maybe Sean, you can jump in and give us a sense of what school districts are preparing for.
Sure. Well, thank you for the question. First, I wish that NJA could just set the regulations. Unfortunately, we cannot. That said, I certainly understand the intent of the question. But I want to tie it in actually with a little bit of what the doctor was just noting, because I couldn't help but, as a high school science teacher myself and listening to all the things that she was describing, aptly going through all the safety pieces needed, just thinking to myself as a high school teacher, and then my wife teaching middle school and those teaching younger grades, just the impossibility of almost everything that was described, not having the contact in the halls, making sure the kids understand and respect their space, they keep their masks on, making sure that the time in an office or in a building is quick, and you wait until you get called in versus we're in there with them for hours. And, it's a lot, which is why, we've been saying we should be looking at preparing for a virtual learning, distance learning experience that is robust, engaging, exciting, all the things that we didn't have a chance to start with last time because of the fact that literally educators were told, over a weekend, by the way, you're not coming back, we're going all virtual. I think people did such a wonderful job with that. But we really have an opportunity now to say, yes, rightfully, we've been focusing on what some type of opening plan might look like, but we should acknowledge that the difficulties around that, the inability to have the testing as was described, the other components that aren't there, we should be putting that time into providing the platforms and resources that our educators need for a robust distance learning environment. We should be training them, but also then including the parents and students in that training, so they're learning the systems at the same time that our educators are. There's not that initial learning curve to start the year, figuring out whether it be by grade level, by school, by district, what parameters around homework are, what parameters around how the instructions are going to be presented. There's so much that can be done and so much time and energy that's needed to do that well, that I think we've got to start focusing there, because the longer we are taking time away with solving some of these issues that just seem harder and harder and harder, more impossible the longer I hear the doctor talk and others. I just think that we've got to focus on making sure we're providing a awesome quality learning experience, addressing some of the inequities that are barriers to that have existed before and we need to address now and into the future, and making sure we give parents and students that clarity that the question really gets to the core of.
Superintendent McCombs, what are some of your teachers planning to really be engaging when you're all remote this semester?
Yeah, that's a great question. And to also follow up and add on a little bit to what Sean was sharing, inequities, whenever that word pops up, it's like a buzzword, because, one of the things that we want to do is make sure that we are able to provide equitable outcomes for students regardless of their zip code. So one of the things that we learned, and then I'll talk about engagement for a bit, from transitioning into a remote situation back in March, when we did that, we were hit with the fact that, hey, we knew the digital divide existed, but it was just underscored and highlighted even more as a result of the pandemic and having to teach in that remote way. And so one of the lessons that we learned, and one of the silver linings behind the cloud of this pandemic, was for Camden City that we were able back in March to, I wrote an op-ed, and there were responses from philanthropic donors who provided $400,000 in order for our high school students to be able to have Chromebooks. And then we were able to repurpose our title funds in order to ensure our kindergarten through 8th grade students had access to tablets or Chromebooks. And so by April, we were able to have procured pre-K, kindergarten through 12th grade Chromebooks and devices that would be able to be utilized in the pandemic. That has set us up so that because we're opening up virtually only in September, we at least have put a huge dent in the digital divide, which is so very important. So when we think about, okay, then screen time, we also know, and I started teaching kindergarten back in 1991. That was my first teaching assignment. And I was also a director of early childhood education for a while in the district. Screen time, we know for all ages, right? But especially our youngest learners, that we want to make sure that we are engaging them in multiple ways. And screen time isn't always the best. But we know that in this remote situation, we have to rely on that because that's the best that we can offer. So how do we engage? We have set aside training, very robust and rigorous training for all of our grade levels this summer for teachers to be able to really work together to provide share best practices in the most engaging remote instruction, but also to be trained from outside vendors to come in too and to share those best practices. So we are trying to do whatever we can to elevate our instruction in this pandemic. There is no substitute for a teacher being in front of students and engaging. Like we know that there is no substitute, but because health and safety is primary and paramount, we're going to utilize the platforms that we have. And we are mandated to provide a thorough and efficient education. So robust and rigorous training will help us to do that. Also, lessons that we've learned from our remote instruction previous to this new upcoming school year will help us in determining scheduling, how much time should be allotted for each of the sessions and the different subject areas. What are some ways to integrate more kinesthetic learning into that remote structure? So we've got lots of wonderful training on board. And in addition to teacher training, I'll end on this point, family outreach and training of our families is also so very critical because they are on the front line supporting and helping us in our connection with our students' education. And so in our district, we are fortunate to have a position called a family operations coordinator. We have one assigned for each building, and the sole purpose of that position is to ensure there is strong connection between home and school and to support training in areas that will help our parents to be our partners in education and educating our students. And so that position has been extremely important during this remote learning period. And our family operations coordinators will be providing sessions, online sessions, outreach to our families to ensure they're getting the training that will help to support engaging, effective, standards-based instruction.
Tina, could you jump in very briefly about what's happening with your teachers at Delsey on that point? We're talking about making these really engaging, robust virtual classrooms.
Absolutely. I just want to start to thank Amanda for that question, because I will tell you, March was a shock for everyone, and we were all crisis teaching. I mean, that's what I felt like. I felt like I was learning as we went along, as I was trying to help the students, and as I was trying to figure out this online teaching. So we were all crisis teaching, and we don't want to end up back in that position again. So over this entire summer, I can tell you, I spent the entire summer along with countless other teachers and administrators coming up with great plans about how we can improve our online voice when we speak and help students. So I really do believe, with safety in mind, we still have to continue to push for 100% virtual, and that we need to focus the remaining part of this summer on making our online learning the best that we possibly can.
So I do just want to hit this one point very quickly, because we have a bunch of questions to get to in the next 15 minutes. But this is for Tina and also Sean, because we have many rural districts in South Jersey. What is busing going to be like as the transition, for the schools who will not start out all remote, or even when we start to transition into that? Can either of you tell us what that would be like right now? I think only 11 passengers are recommended on a 54-seat bus.
Well, I think the end there is a great place to start, right? You see, you're kind of highlighting some of the challenges that we even begin with. And I have to tell you, talking with one of our colleagues, a bus driver, and just, even hearing the challenges that she was facing in part of her district's team trying to figure this out, because we were talking about, in the case of her and I, speaking about hand sanitizer. And I was like, well, are you going to have them wiping their hands before they go on? How does it work? And she said, Sean, do you realize that because of the alcohol content in the hand sanitizers, we're not allowed to have them on a school bus? I said, I did not. There's just layer after layer after layer, that presents challenges here. I think it goes to what Tina was saying. I think that's, again, why I think we're better off figuring out, quality distance virtual learning experiences that provide that instruction, that meet these standards, as our superintendent noted. I think there's a lot of pieces there that should be the focus. But, in terms of figuring out all the logistics around this, I think that's part of the problem. I think we've got a lot of great people working on this for quite some time and just haven't been able to figure out all of the pieces. And I think that's going to be a challenge.
A Lindenwood preschool teacher, Emily Klinke, asks, can the staff dress code be revisited to include scrubs or other clothing that can withstand constant washing or sanitizing? And she's looking for that to be a mandate from far above her school district to apply to everyone. Any comments on that?
Well, I will say this, in terms of what we're talking about, and I think it's important for parents to recognize this too. I think a lot of people have a vision in their mind of their kids going back to school, and it's going to be going back to what they are used to. In some way, whether it's barriers, whether it's, even the description in the question, our educators acting like medical professionals, wearing all of the PPE that's needed to be safe. These aren't experiences that are what kids are used to, and quite frankly, probably comfortable with either. I think that we need to be acknowledging that as we go forward in the conversation. But to the other piece, which is, should this be happening more broadly? I'd have to say yes. I think some of the criticism that happened at the national level was, we all saw that it was left to each state to kind of figure out, to get what was needed, to decide your own plans. And it's widely criticized as a complete failure. And I think that even here in this state, and I appreciate the fact that every district is unique and is doing their best to come up with individualized plans, and there should be flexibility. But again, to say, hey, districts, you need to go figure out how you acquire those devices, and thank goodness you can get, public-private partnerships, or you need to figure out how you're going to procure the materials, or you need to do this and we'll reimburse you. I mean, it's a little bit like what we saw at the national level, and I think the more broad standard of just, hey, figure it out. Should they be wearing that equipment or not? Decide on your own. I think those should be more organized through the state at the state level. We've seen it in other areas, right? The state has not come back and said, hey, every restaurant, you figure out what in-person dining looks like, give us your plans and we'll be good with it or not. They've said, no, we're not doing it. It's not safe. I think there's got to be a little bit more broad guidance from the state.
So I have a question from Tom Jones in Audubon Park, and it has to do with private schools versus public schools. And it comes down to, how come in-person instruction can be done in private schools, but not public schools? I think I've seen that debate circulating around social media quite a bit. Would anybody like to weigh in on that one?
Carly, let me understand your question a little bit more. I'm sorry. So the question is, Why can private schools have in-person, remote, fully virtual instruction and public schools cannot? I may have missed the question.
He wants to know why many private schools are doing all remote, are doing mostly in-person instruction. Now, I haven't looked at figures on private schools. We've been talking about public, and he says, but there's a big push for public schools to go virtual. So I think he wants to know, like, what's the difference?
I'm not sure. Yeah. I won't address that question. I understood it a little bit differently. Sorry.
Gotcha. Okay, we can move on from that, but maybe have a conversation about it at a different time. I have an interesting one that came in. It is about the exceptions of masks. I know music and phys ed classes were among those exceptions. How do you think, and how are spread going to be mitigated in those settings? I know that there were provisions saying, go outside and have those classes. So we're just going to have choral groups on the grounds outside, which could be quite a nice thing. Tina,
go ahead. I'm sorry, Carly. I'll follow your lead.
I was just going to, ask if somebody knew what was happening with that in their schools.
I guess I could comment on that. I know every school is, I think, handling it a little bit differently. And I think that's part of the problem that we've said, that a lot of the regulations are very broad. And I think that sometimes creates problems from district to district. So every district is treating that a little differently from what I've heard on how they're going to handle kids that can or cannot have masks. I think that we have to remember that we need to keep masks on the kids. We need to keep kids 6 feet apart. And if they can't wear a mask for a medical reason, then we need to make sure we have some type of plexiglass in order to protect all the students and the staff, and also to protect our community, because we know if a student gets it, they can take it home to someone in their family. So we need to do everything in our power while they're in that building to be as safe as possible.
Rue, did I see that you had something to add on this?
I know that in Lumberton, they're not really doing the specials anymore. When they were talking about the hybrid schedule, they were no longer going to be doing the specials in school. It was going to be more of go home, and that was the remote type thing. I know, speaking personally, I'm actually in a choir myself, and we have not been able to rehearse together, and it stinks. But we just all have to kind of stick together and get through all of this, and just keep telling ourselves that it's not always going to be like this.
I do know that in addition to sports, which is a topic that we're hopefully going to tackle in the next couple of weeks in the same format, marching bands are starting now. Dr. Lightfoot, could you, do you know at all how how far droplets can spread if you're basically blowing them through a saxophone or while you're singing?
It's interesting you should say that, because my retired husband plays in a jazz band, and it's my pet peeve. So, so I allow them to practice 8 feet apart. All right, so through the saxophone, since they have plexiglass in front of them, the saxophone players, and they practice with that 8 feet apart for rehearsal. And they all have their petitions 8 feet apart with plexiglass. That's the only way I will allow them to practice. This is not performance, they're practicing. Now, as far as the choir, it's interesting because we deal with that too. So my husband and my brother also orchestrates a choir in Washington, D.C., since we're on it. He directs his choir through the web. He sets it up with their individual rooms, and he's in a room, and he directs and orchestrates the choir through the web. He sets up the Zoom, and they're in I know how to do this. I'm not that tech savvy. Ask Mike. That's why I can't see any of you right now. But they're in their individual cubicle squares, and he's in his square, and he directs them, and they rehearse that way. So then when this is over, they can perform. And they have choir rehearsal every Saturday night from 4 to 6. So that's how they do it. So
Okay.
they do about that. So
All right. So
in terms of projection of droplets with a good blow, you're talking 15 feet. Now,
okay.
that also depends who's in your direction. But if you have the screens, it's, if you have the clear glass in front of you, it's just you and your screen. Now, when they're outdoors, they're outdoors.
Gotcha. So we are coming toward the end of this hour. I'm just looking for a final thought from each one of our panelists moving forward as things change. Decisions have to be made on the level of a mom, a teacher, in the executive status. Can we just go through and maybe start with Sean, something that we should remember going forward?
Well, maybe I can steal something from Rue if that's okay, because I love what she noted, that this is not going to last forever. And I think it is important that we check in with that on occasion. We always talk as educators about checking in with our students' social and emotional health. That's such an important piece during these difficult times. But even as parents, certainly as educators, as doctors, as administrators, as reporters, and certainly as society, we have to check in with our own emotional and social well-being and understand that these are tough decisions. They're often is not a good decision and a bad decision. These are difficult decisions we're having to make that aren't ideal. But I think when we look at it through the lens of, we need to remain focused on the safety and well-being of our students and our staff, because at some point we will be through this, and we will certainly not have wanted to jeopardize anyone's health, a family member's health, because we moved at a time frame, at a pace that we arbitrarily came up with. I think we need to make sure we're focusing on safety here, but everybody understand that we're going to get through this. We're going to be okay, and our students are going to keep learning, and New Jersey is still going to keep having the #1 schools in the nation. We're going to get back to what we know and do well, and it'll be sooner rather than later as we move through this in the scope of the larger sense of time. So remain focused on that.
Superintendent, do you have anything that you're keeping in mind or that we should?
Yeah, I think along the same veins that Sean just spoke to, knowing that there is light at the end of the tunnel and that there is hope is very helpful. But while we are navigating through this tunnel until, the science and vaccines and everything are in place to allow us to fully all go back and pick up that new normal, I think flexibility is key. I've been trying to over communicate in every setting where I've spoken to, whether it's board meetings or to teachers and families, just to make sure that I keep underscoring the word flexibility, that all of our planning is flexible, and that we have to all be ready in order to pivot when necessary to a different style of or modality of learning. So I think flexibility is the key. I think always grace and unity, being able to make sure that as a collective group, we are all ensuring that we're focused on what's best for our students and our staff members, so that we can continue to provide them with the wonderful educational opportunities to have them thrive in their outcomes. So again, flexibility, being gracious, and also just unified in our approach as we are delivering key information to our families and communities about what school looks like during this time.
So that's the time we have for our first episode of NJ Press Pass. I just want to thank Dr. Lightfoot, Vice President Spiller, Superintendent McCombs, Delsey Ed Education Association President Tina Dare, and Committeewoman Ryan for answering our call for information. Keep those questions coming in the comments. We'll be checking them over the next couple days, even in the replays, because as promised, I'll work toward getting answers to those questions that we took in the comments today. So be sure to follow NJ Press Pass web series group on Facebook for follow-up on this conversation and to participate in the next one. Like I said earlier, we are working to build a show around the return of high school sports. So if you have questions or comments that you want to bring up on that, please email me. Questions are already coming in on that topic, and we're starting to build from our sports team source lists panelists to answer those questions as well. So you can start submitting them for the next panel by commenting in our group, tweeting us at PressPassNJ on Twitter, or emailing me at njpresspass@gannett.com. Thanks for joining us, and we hope some of your back to school anxiety has been alleviated for the moment until the next change happens. Thanks a lot.